On Friday, July 17th, protesters gathered at the offices of elected officials across the country to oppose socialized medicine. One such protest took place outside Senator Jim Webb's office in Arlington, Virginia. Bureaucrash was on the scene.
My name is Sasha Gong.
I understand you have some personal hands-on experience with socialized medicine.
Oh, very much. I'm talking about China. I came from China 23 years ago. And actually in China in the 70s, 60s, 70s, and 80s, everybody in the cities, I'm not talking about the peasants, I'm talking about city residents, they have government-covered health care. When you have that, two things are guaranteed. First, you'll have shortage. Remember all the long lines in Soviet Union, China, and all the socialist countries? You'll always have a shortage when you have government run, whatever stuff. And second, you have corruption. And not mentioning the incompetency, bureaucracy, whatever. But the two things always happen when government nationalizes any industry. You have shortage, you have corruption. I remember there's a saying in China in the 1970s, and they told people that, well, you better have 3 daughters. In that time, you can still have 3 daughters. One married to a butcher because of meat shortage. One married to a purchase manager because of shortage of everything. The other one married to a doctor because, you make sure you're covered. Otherwise, you're not. So that's what happened. That's what happened in every industry, every single industry. And I think people should read history in the 20th century much more careful than they do now.
Thank you very much.
Thank you.
All right, so why are you here?
I'm here for my daughter because I care about our country, and I don't believe that Obama and the Democratic-controlled Congress is taking us in the right direction.
What is the
They're already spending her money. So.
What's the direction that you'd like the country to take?
Well, I believe that the country was founded on individual freedoms and individual responsibility, and I believe that we're headed down a socialist path that is very contrary to that, and it leads me to believe that freedom as we know it could very easily disappear within less than a generation.
Is there any one particular thing that's happening right now in our government that makes you most upset?
I am most concerned about government control of things that were never intended to have government control. Healthcare is just a symptom of that government control gone out of control. There's also the stimulus spending. The government has no business being involved in the economy and bailouts and things. So to boil it down, it would be government over control.
I'm Tim Phillips.
Thank you.
Thanks for coming out today.
No problem. I again like to thank you guys for coming out and expressing your views.
I was going to put this here. These are petitions to Senator Webb. It just says, hands off my health care. And it asks folks to vote no. Ask Senator Webb to vote no on the health care legislation. It's not individual names of Virginia across the Commonwealth. And that we just want to make sure you guys Senator Webb.
They'll definitely get to the correct people on that legislation.
We want to thank you for coming out.
You're welcome.
And I know Matt joins me in thanking all of you for coming out. I think you ought to give yourselves a round of applause for what you're doing. You hear about grassroots politics, right? When it's noon on a Friday, you've left family and jobs and businesses and everything else because you care about freedom, right?
Yeah.
And you care about protecting your healthcare choices so it's you and your family and your doctor, not some bureaucrat in Washington across the river, right?
Absolutely.
And that's why you're all here. And on behalf of Americans for Prosperity, I want to say thanks. And Matt, we're delivering these to Senator Webb. I know Lisa is here with the Tea Party. You want to say a couple of words? Or?
Sure. Hi, my name is Lisa Miller. Nice to meet you. I have a small business here in Arlington, Virginia, in insurance and financial services. So I'm here after surveying my clients over the past 15 years of serving them to ask for Senator Webb to consider that the monopoly and mixed economy that we've been subjected to for the past 10 years that have proved dismal in terms of performance, which is reflected in the high fraud rate in Medicaid and Medicare and their inability to regulate themselves. And so I ask that they reset the markets return to commerce, charity, and the individual their rights and responsibilities so that the most people can have the most opportunity. They could re-regulate these policies to cover the people that are uninsured right now. A large segment of the uninsured are adult children to age 25. They could just simply modify that policy to allow parents to continue to pay for their children. So I'd like better transparency. I want government out of healthcare entirely, and I want you to be the honest brokers that you should be in regulating competitive market.
Thank you.
Hi, I'm Lee Dorn with Bureaucrash.
I'm Lisa Miller. I'm a small businesswoman in insurance and financial services in Arlington, Virginia. Well, I helped set up the July 4th Tea Party in Washington, D.C. It's teapartywdc.ning.com. And I'm here today to step forward to speak about private markets and maintaining competitive markets. And I'm here to ask Senator Jim Webb to remove government from competition with the American people. It has proved to be a disaster in the past 10 years. It's driven unemployment. It's impoverished us in terms of services as well as lost opportunity in both business and personal lives.
And why do you think the private care would work better?
That's all right.
Well, if you look at like DC public schools, which is in essence a monopoly, they have actually destroying competition by eliminating their DC voucher. They just voted on that. And you look at their 50% dropout rate, you look at their inability to produce many graduates that can read and write, and it's a plain, it cries out for competition. But it's not in the government's interest to let go of that power, let go of that control.
Well, what do you have to say to those millions of people who are uninsured?
Well, there are great ways to insure them. There are plenty of ideas out there, but the government has to write the regulation that permits that competitive aspect, that allows innovation, that allows improved convenience to the client, that reduces the costs, that broadens the choices, that makes it clearer how they can better take care of themselves.
Hi, I'm Lee Dorn with Bureaucrash, and I'm with...
Tim Phillips, President of Americans for Prosperity.
And why don't you tell us a little bit about your group and why you're here today?
You bet. We're a free market grassroots group, Lee, and we work with stuff just like this. So just like you, we asked some of our activists to come down today. It's not easy. Noon on a Friday, folks have jobs, families, kids. But you know what? People care about freedom. That's what we're finding out today and across this country.
And what do you think the problems are with why the American people, some of them do want socialized care? What do you think they say?
I think they hear President Obama talking about this paternalistic security. And sometimes it's easy to be loyal to that. But when you go for that line of big government reasoning, you lose opportunity, you lose freedom, you lose the ability personally to run your own life. And I think that's when people are waking up and going, you know what? I do want to choose my own doctors. I don't want some bureaucrat running. I do want to choose which kind of insurance I have. I don't want some one-size-fits-all deal with the government. So these guys can't run a post office, they can't run TSA well, they can't run Amtrak well. Why would we want to give them something as important as a health care program?
It doesn't make any sense. And if Medicare doesn't work, if we can't afford Medicare as it is right now, we're completely bankrupt. How are we going to be able to afford paying for the entire country? Only a politician that would make sense.
That's right. Only a politician would say, let's see, our deficit this year is $3 or $4 trillion. It's about 13% of our gross domestic product, right? Let's do another $1 trillion entitlement. That's only going to get bigger.
Yeah. I definitely appreciate you coming out here.
Love working with you. You bet we will.
Thank you. This is Bureaucrash. All right, so why don't you tell us why you're here?
The idea of government run healthcare kind of makes me sick. So I'd rather see less government involvement brought down by free market ways. And there are a lot of better ways to bring down the price of healthcare.
I think it's taken me out with it.
What are your biggest concerns about socialized?
My biggest concern would be that people aren't going to get the care that they deserve. And the price is just going to be astronomical for all of America.
Hey Grant, why don't you tell us what you're holding?
This is a bottle of unpriced bottled water.
On what?
Unpriced.
What is unpriced?
It means I didn't have to pay for it.
Doesn't that mean it's free?
No, because someone paid for it.